Hi, everyone. Thanks for having us to participate today. My name is Professor Bradley Williams. I have the role of Pro Vice Chancellor for University Impact at the University of Wollongong. And it really is a pleasure to be here today. On behalf of the university, I'd like to acknowledge the traditional custodians of knowledge on the lands on which we meet, both here in Wollongong, in Eurobodalla, and any other place where people are joining us from. And I pay my respect to elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander people present today. Jamie, to you and the team, thanks so much for these arrangements and for having us online today, and also to those in the library and the council. Thanks so much for this important event to raise awareness about breast cancer. And I was really pleased by some of the comments earlier mentioning that men can also contract breast cancer, because there is a very large lack of awareness of this particular fact amongst men. You know, it's largely considered to be women only. So now I'd like to introduce our next presenter, who is Associate Professor Deirdre McGhee, and she works in the School of Medicine, Indigenous and Health Sciences at the University of Wollongong. And she's the co-founder and director of Breast Research Australia, abbreviated BRA. Deirdre's clinical background as a sports physiologist has enabled her to drive clinically focused research that addresses real-world breast-related problems. She's passionate about women benefiting from her research, and that's also a theme about the institution. You know, as an institution, we really want to bring benefit from the research that we do. And she links her research with sports medicine, and community-based organizations to ensure her research outputs integrated and translated. Her aims are to enable female athletes, active women, pregnant and postpartum women, and women living with breast cancer to maximize their participation and performance in physical and exercise and activity. And that, of course, relates to some of the conversation that we've just heard. Deirdre has a particular interest in bra-related issues and physical recovery of women following breast cancer surgery, and how they impact physical activity and resumption of sport, work, and other daily tasks. I'm now pleased to welcome Deirdre to deliver her presentation entitled Bra-Related Issues Experienced by Women Living with Breast Cancer and the Need for Breast Support Education. Deirdre.
Thank you very much for that, that introduction. So I'd also like to acknowledge the traditional owners of the land I'm currently on, the Wadi Wadi people of the Darwell country, and also pay my respects to elders past, present and future. And we've already got a lot of this background, so I'll skip this slide, but maybe just to stress that I've worked with both the McGrath Foundation and Breast Cancer Network Australia to ensure that the research is translated into community-based resources that actually benefit women living with breast cancer, is the topic I'm talking about today. So when we talk about bra-related issues, like what does that mean? Right? And so if we talk about discomfort that a bra can create, and remembering that a woman will wear a bra for about 12 to 14 hours a day. So even if we say this discomfort is mild, if you times that by 14 hours a day, 7 days a week, that type of discomfort can really accumulate and really affect a woman's quality of life. But after breast cancer surgery and treatment, there can be issues with sensitivity of the bra rubbing or chafing or irritating the tissue of the trunk that's either has surgical scars or is perhaps being damaged through radiation. And also lymphedema within the breast or the upper limb where the bra strap is sitting can definitely affect both the lymphedema and the discomfort. And a woman can have, after surgery, ongoing pain in that upper torso region where she's had the surgery and treatment, and the bra can aggravate that pain. There's also much more difficulty with bra fit due to asymmetry of the breast. If one breast has been affected by either, a mastectomy, if they've had a reconstruction or a prosthesis, but even let's not underestimate how much breast conserving surgery can really affect breast shape and the pain and discomfort that a woman experiences. And the trunk can also be deformed from the surgery and the radiation. A bra is a tight-fitting garment, and they're all made symmetrically. So if you're no longer symmetrical, the fit can be far more challenging to get right. Women also have problems with getting a bra on and off, and clinically we call that doning a garment or doning a bra. And because of restrictions in shoulder range of motion after surgery and treatment, or problems with dexterity because of effects of radiotherapy on the nerves within the periphery, within the ends of the upper limb, that can affect a woman's ability to do up a bra. And then definitely we have to remember that breasts are part of a woman's sexual identity. So it's very sensitive for a woman how her breasts appear. So definitely changes with asymmetry, with the appearance of a cleavage, and just that whole body image, that can really affect a woman's emotional and physical well-being in terms of her identity as a female that her breasts are part of. And then when a woman's had a mastectomy and she's now wearing a prosthesis, there's additional problems. Not only does she have those issues with that skin sensitivity that then the prosthesis may be touching or attached to, there's also problems with the prosthesis fitting to the chest wall or fitting within a bra. And definitely there's very limited data available on what is the optimal weight of a prosthesis. So we can't just match the weight of a prosthesis to the weight of an intact breast, because the breast is attached to the chest wall. So it always has to be lighter, but what that optimal weight is, really there's very little data for us to base that on. And it's challenging for a woman to get a weight of a prosthesis right that suits her. So there's a lot of trial and error that really needs to go into play for a woman to get that prosthesis comfort for her. And the prosthesis and the bra have to be a unit. So whenever you're buying a new prosthesis, you have to have the bra selected first, because they've got to actually work together to support it to your chest wall. And again, with the prosthesis, because they're trying to match it to the other breast, there's definitely challenges with asymmetry. And the same thing, I was really glad that Lisa brought up the partial prostheses for women who've had breast conserving surgery, that they know that these are available to try and match up that symmetry. So don't just think about, when we think about prostheses, we shouldn't just think about women that are having a mastectomy. We need to think about women that are having breast conserving surgery as well. So you can see that there's a lot of challenges for females in terms of breast support who are living with breast cancer. So what are the consequences though? Is it just that, women are uncomfortable, and it does tend to be a notion that, well, you're alive, so maybe I should just put up with this discomfort, because I've survived my cancer, and so what we wanted to look at is, well, what are the consequences? Is it more than discomfort? And what we found is that it's actually a barrier to women being physically active. So it's all very well for us to say, to decrease your risk of breast cancer, you need to be physically active, you need to do this. Well, we've actually found that not being able to get a comfortable, supportive bra is a barrier to women being physically active. And you know what? It's not just women who have breast cancer, it's all women. So when women cannot find comfortable, supportive bras, it actually limits them being physically active. So that's why it's a priority that we help women more with their breast support who are living with breast cancer. We also know that it can aggravate already the physical symptoms that women have after breast cancer surgery. And one of those, which is absolutely dreadful to have, is lymphedema. And anything we can do to help lymphedema, we need to do. We also know that it affects the posture, and Lisa spoke partly about this in terms of that asymmetry that can happen in the trunk. So it affects the posture of the trunk, and the posture of your trunk affects how your arms move. So if I tend to be more curved in my trunk, I can't lift my arm up as high. So all these women that have shoulder problems, we want to get their posture better, so we improve their shoulder mobility. In order to get their posture better, we need to get their bra better. you know, so it's just part of the sequence of events that needs to occur. And then, as I said, this whole body image, sexual identity, quality of life, it's all so, so, so important to all females, and it's particularly problematic for women living with breast cancer. So then so they're the things that we know. What do we don't know? So what is our current lack of knowledge? We don't really know the prevalence and severity of these bra-related issues. So we know they exist. How bad are they? Should we be worrying about them? What evidence do we need to try and push the agenda that we need to do something about this? And what are the current management strategies? What are we currently doing to help women with these bra-related issues? And what's the evidence we need to base, can we make this better for women? So I ran this study to investigate, and I was investigating women who had all different types of breast cancer surgery, whether it was breast conserving surgery, whether it was mastectomy or reconstruction. I wanted to ask those women to get their voice to say, how frequently and how severe are these problems for you? And what's your perceptions and your level of satisfaction with what the health system is currently doing for you? So the care that you're currently giving, what do you think about it? So I had 500 women across Australia be involved in this study, and they were a mixture of women who had breast conserving surgery, mastectomy, and breast reconstruction. You can see I've put these little abbreviations in. BCS was breast conserving surgery, mastectomy, and then BRS was if they had reconstruction surgery. And that was both if they had an implant or they had what we call an autologous reconstruction, where tissue is taken from some part of your body to recreate your breast. Oh, that's not okay. And we did a cross-sectional survey study where women went back. So it's retrospective, means they told us what happened to them, and it was anonymous. And we asked them how frequently and how severe did they have these bra-related symptoms 3, 6, and 24 months following their surgery. And what was their satisfaction level with their management, and what was their perceptions of it. And it was a mixture of qualitative data. So the qualitative data means that we had open-ended questions where women could write. And I deal a lot of the time with athletes, and women living with breast cancer are a breath of fresh air. It's very hard to get an athlete to fill in a survey. And if you give an open response, they might write one line. Women wrote paragraphs, paragraphs about their bra-related issues and what they went through. So we analyze them qualitatively, and that's quite a complex methodology we use, where we read and reread the data and we develop themes from the data, and we then take quotes from women. So there's normally 2 or 3 researchers that are involved in that, where we really explore what these women say. And these women said a lot, okay? They were absolutely wonderful participants to have. And then quantitatively, we looked at what was the frequency and the severity, and we gave it a score out of 10. So if you said it was all the time and really severe, that would be 10. If you said it didn't happen, or it was rare and it was, really mild, then that would be 2. So if you think about the difference in that score. So if someone who gave a higher score, so we said if it's greater than 6 out of 10, we'd call that moderate to severe, because it's frequent and it's severe. And then we did what delivery method. We asked them, how did you get education or treatment, and were you satisfied with it? Okay. And then these statistics we do to analyse the data. So they're statistical tests that we put through a program. And what we found, right? So on this vertical axis here, I've got percentage, and on the horizontal axis, I've got 3, 6, and 24 months. So that's telling you their scores were at 3 months, at 6 months, and at 24 months. And you see there's 3 colours: the breast conserving surgery group, or the lumpectomy group; the pink were the women who had mastectomy, and the blue were the women who had breast reconstruction. And basically what we found is, if you look at the 3-month mark, these were women who had a score of greater than 6 out of 10. So these aren't women who complained of mild problems. There was everyone, right? That complained of mild problems. But if we just look at the percentage that said I've got a greater than 6 out of 10 score in how frequent and how severe my pain is or my discomfort is from these bra-related issues, you can see that there's not really any difference between the three groups at 3 months, and it's high. So at 3 months post, nearly over 50% of all three types of women had moderate to severe bra-related issues. And then at 6 months, that went down to about, 40%, and the breast conserving groups start to separate here, and they're a bit better. But then if we look at 2 years down the track and you think, well, that's pretty much what she's going to be like for the rest of her life, we still have about 25% of women that have moderate to severe bra-related issues. So we just think, wow, that's pretty bad, isn't it? And then if we look at what were they wearing, you go, green means good and red means bad, basically. So if we look at the red, you go, well, half of them had bra-related issues where I'm not happy with I've bought a new bra, but I'm not happy with the fit or support. I'm wearing my old bra and I'm not happy with it, and 16% couldn't wear a bra. Now, if you can't wear a bra, you can't exercise. It doesn't matter if you've had breast cancer or not. Women who are topless don't exercise. Yeah? And then if we look at the delivery method, and I'll just put the screen up here, again, red, bad, green, good, if we take it simply, a third of the women got no information about their bra. And this is what they got told from a health professional. So this could be a breast care nurse, this could be a physio, it could be a doctor. So this is, what is the health system doing for these women? A third of them got a pamphlet or a business card to go to. And in the qualitative research, a lot of women didn't go. So we've got they were given these cards, but these women aren't following up with these bra retailers. And that's a combination of cost, they can't afford it, sensitivity, that they're just so traumatized, the thought of someone seeing them again, they just don't want to go there, or a lack of understanding that their old bras are probably not going to work anymore. They sort of want to go back to their old bras because they want to go back to how they were, and that's not really working. Whereas if we go from a breast care nurse or a physiotherapist who got some type of follow-up, it's, less than 20%. So less than a fifth of women got any type of follow-up to say, how's your bra going? Can we give you a hand with that? Those women that did said that was so helpful to them, So I think just that little bit of education can make such a big difference to a woman. Then we said, who's satisfied? Can you rank your satisfaction level for us? And we've got a third that are really satisfied with what we're currently doing. If we look at their perceptions, their perception was they needed education and guidance from health professionals on bras and prostheses. So it's, great the service that Lisa's offering, but the tragedy is a lot of women can't afford it, and a lot of women don't know of it, or they're not getting someone good that they go to like Lisa, and they're just buying whatever is available at that shop. And women in rural and regional areas really felt they suffered from this a lot more because they just didn't have the opportunity to be fitted, or it was just too difficult from their regional area. The timing and accessibility of that education was really important. Women felt they were inundated with pamphlets. They just get a whole lot of pamphlets when they're going in for their surgery. They are not in the mind space at that stage to read anything, and most of them just go into recycling. So when we give these women this education, and particularly again in those rural regional areas, a lot of women from rural regional areas came to a big hospital, maybe in the city or maybe in a big regional area, and then travelled back to their rural areas, and they just had no cancer-specific expertise in their area to access that education. So we really need to look at the timing when we're giving this education and making it accessible to women across Australia. Some of the perceptions, you can see where they're saying the women are saying, if I could be given this information, it would have been so much beneficial for me. Or can we make some type of standardized kit where all women have accessibility to this information? Others talked about the psychological trauma that it went through of not being able to have any help and not being recognised. This was not being recognised that as a real problem for them, and being downgraded by the medical, profession, both doctors, physios, breast care nurses. We're not just saying that it was an issue with the doctors, but that it was saying, well, you just have to live with that now. And we're going, well, no, you don't actually. It can be better. And then this follow-up, like talking about bras while they're waiting to find out, am I going to live, is not going to sink in then. But when they have survived and they do have to keep living, that becomes actually really important to their survivorship. So in conclusion, a high percentage of women have moderate to severe bra-related issues following all types of breast cancer surgery, and women desire more education from health professionals to help them with breast support and bra fit after surgery and treatment. So you go, all right, we do this paper, we do this research, we write up the paper, we go to a conference and we present it. And you go, well, the people who really need to benefit from this, are they? Right? So what's our action plan? We need to provide education to women freely on bra fit, bra design, and so they understand different features of bras, when it's appropriate to wear a bra that's supportive and when they can wear something more lacy. Right? So we need to educate women about bras. We need to guide women bras are expensive. A lot of the thematic analysis women talked about, they spent so much money on bras and prostheses and they couldn't wear them and they were so mad, and they don't bring them back. And particularly women in rural areas, or even in women who are time poor, they're buying bras online and then they succumb to the pressure to buy something. They go to the bra shop, someone's fitted them, they feel pressure that they spend all this time with them and they buy it even though they don't really like it. And we just go, you've got to be strong and not buy something that isn't comfortable. If it's not comfortable when you're trying it on, it's never going to be, right? So I say to women, you buy it online, you try it on, it doesn't fit, you send it back. And don't be succumb to buying something just because someone's fitted you in it. And we really need, from the medical profession, far more referral to breast care nurses and to physios to give women this education and to ask them, how are you going? One of the questions should be, how are you going with your bra? And we really need, there's women out there and there's physios out there who've got solutions to common problems. There's common problems women have. How do we get that information out? So it's more equitable to women across Australia. There's a small percentage of women that are getting good care and there's a big chunk of women that are getting nothing. So how can we spread this education around? And then how do we do that with the limited resources in the health system? And we all know that there's limited resources. So if I went up to the area health district and said, every woman that has breast cancer surgery must be referred for physiotherapy to get this, they're just going to go, dream on, Deirdre, it's not going to happen. Right? So how can we try and solve this problem? So our solution is myself and another physio, Teresa Lee, who works at Royal North Shore. We've got together, we've linked with the McGrath Foundation, and we've both been involved with Breast Cancer Network Australia. We want to develop a resource called Breast Cancer Bra Solutions, and we've got a team of breast care nurses and physios, oncology physios, who are very keen to contribute to make this resource freely accessible to women across Australia. And we're currently seeking funding for this, and it would cover bra fit, bra design, and solutions to common problems. So I've previously made a similar type of resource for women who haven't had breast cancer. So, and this is the link to this, and even at the acute stage now, this can guide women, whether you've had breast cancer or not, on the basics of bra fit, this is sports bra design, which is a supportive design, which you need to be wearing after you've had breast cancer anyhow. And then how to check the level of support. So we would follow something similar for our breast cancer bra solutions. We've made this national. This is currently being downloaded about 32,000 times per month by women all over the world in multiple sports. World Rugby, Women's Tennis Association, National Rugby Union, AFLW, so the Australian Institute of Sport. So like it's being used worldwide. And it guides women on, you put in your bra size, you put in your age range, and you put in your type of physical activity that you want to do. And an intense activity is running, jumping, and false alarm movements because they cause the most amount of breast movement. And then it guides you what to look for in a bra. Our resource, you would put in whether you had a reconstruction, a mastectomy, or a lumpectomy, and it would show you features to look for in a supportive bra. It then goes through how to tell correct bra fit. So what to look for to know if a bra fits correctly and what it looks like if it's incorrect. And because we've used so many pictures in this resource, this is used by women who don't speak English. You know, this is used all over the world because there's just so many pictures. They just go, I've got to look like this. I shouldn't look like this. Okay. So again, we would do the same thing, lots of pictures, so it's quick and easy to use. And then in terms of specifically for breast cancer, we would be looking at what we do for kinematics, what do we do for that posture and that ease of getting on and off. We'd go through design features for that, what you'd look for a bra if your breasts are asymmetrical or if you have lymphedema, what to look for if you've got sensitive skin, and what do we know about prosthesis in terms of weight, shape, comfort, etc. So just for an example, I did a few slides of a few common problems. So just say if we look at skin sensitivity, and you can see here problems women have is after radiotherapy, the skin can be affected, and that or there can be issues with surgical sites, particularly drains tend to be right on the bra line and really can annoy, the bra can make the bra really annoy women. Women where they have folds of their skin can also get dermatitis or fungal infections there. And so what type of solutions should we do to solve this? Is a really common problem. How can we solve it? Well, women need to be aware of where they have a scar or where they have a sensitive area of skin. They can't have a seam of a bra on that, right? So you've got to look for a bra that doesn't have any seams in that area. We also teach women, and this is where breast care nurses and physios can teach them about how to work on those scars to make them less sensitive. Sometimes we put a cotton singlet under the bra, particularly for those dermatitis and fungal infections, so we don't ever have skin touching skin, because that's the problem. If you get the skin touching itself, folding on itself, that's where you can get that sweat and moisture forming there. That's a beautiful environment for fungal infections to grow. And then educating them about antifungal creams and also changing the bra size during the day. Like we have a habit as women that we wear one bra for that 12 to 14 hours a day. And often women get home and the first thing they do is they kick off their shoes and they rip off their bra. And you go, what's wrong with this? You know, why do we wear uncomfortable shoes? Why do we wear uncomfortable bras? But sometimes women after breast cancer surgery, their torso and their breast is sensitive and tender, that just changing the bra during the day can often be such an improvement in comfort. So we encourage women to have a spare bra in their handbag, and we just go, just put it in a little pajama case. And then during the day when you go to the toilet, change your bra. And ideally you want that bra to look different to the one you've got on. Whether if you had what we call here an encapsulation bra to start with, you change it that you'd have more of a crop toppy style, but you just change, so you're changing the loading of your tissue. And just that simple strategy can give women so much more comfort during the day. Another common thing is breast asymmetry, that difference in that breast shape or the position of the breast on the chest wall. So just having, you know, with women who've had breast conserving surgery, understanding, like Lisa was saying, these partial prostheses or bras that have greater elasticity that can accommodate that difference in shape. Where straps are falling off, there's glue that you can use to help to hold the bra in place. And then ideas of saying to women, maybe you should be going back to your surgeon to see about, can we do something about this asymmetry? Is this a big enough problem for you that maybe this is something you want to address, and having surgery to the unaffected breast? That's a big decision for women to make, but often then being able to talk to a breast care nurse or a physio about it can help them think about, how much is this affecting me and what am I willing to do to change that? Another then common problem is lymphedema, and breast lymphedema is sort of increasing because of the way we're treating breast cancer. So it can be a big problem for women, and of course that's going to cause breast asymmetry. And often women, because they're so uncomfortable, there's a temptation, if they're staying at home or working from home, they don't wear a bra. And what we found during COVID was, because more people were staying at home, breast lymphedema was actually getting worse, because that bra actually provides some compression and actually helps to limit that or restrict that lymphedema. So the type of bra you wear when you have breast lymphedema is really important to provide that compression. And the weight of the heavier breast is also a barrier to exercise, and having that stagnant fluid in the breast can actually increase the risk of breast infection. So it's really important that we manage breast lymphedema. So having manual lymphatic drainage to address it, and teaching the woman how to do that. These more type of compressive bras that's really covering the whole of the breast and applying some compression. We use pads to try and move the breast lymphedema from certain sections of the breast. Women may need 2 bras because the breast may be too heavy for 1 bra. Where underwire is actually sitting on breast tissue, we don't recommend that you wear underwire. So it's really important that that has to actually sit on the breastbone at the front and at the ribs underneath. And then we look at physiotherapy to try and manage any musculoskeletal issues to the chest wall from these big weights of the breast. So this is our plan to allow this information is known. There are physios and breast care nurses who know this. Unfortunately, they're limited in number, and we really need to spread this information across the country. Teresa and I have already ran education sessions for McGrath nurses and for oncology physios, but we really want to make this more accessible to women and to breast care nurses and physios right across the country. So if there's any clinicians in the audience and they would like to be involved in this breast cancer bra solutions, we are so willing to have any and all involved in this, so that we can make this resource as good as we can. And if we have patient advocates already involved, but if there's any women in the audience that go, I want to be involved in that, and I've come up with a good solution for my problem, we're so willing to hear any stories from women, because women have developed so many solutions themselves. And the beautiful thing about women living with breast cancer is so many of them want to do things to help other women. So it's a beautiful community, and as a researcher, I'd have to say, absolutely inspiring to work with these women who just want to make things better, and with you there to do that. So this is my partner in crime, Teresa Lee. These are 2 of our patient advocates, and no research is ever done in isolation. Dry July, McGrath Foundation, Reclaim Your Curves, Breast Health Connect Australia, Register for. Thank you for all your help for this research.
Thanks, Deirdre. Thanks so much for that. What is obviously a passionate area for you. Maybe if you stop sharing your screen, it'll be easier for people to see. And I'm sure that people may have questions. So from the side of the library there, if you do have questions or online, please just let us know, and I'm sure that Deirdre will answer. Just noting that the library is muted at the moment.
Bradley, thank you, Deirdre, for a wonderful presentation. No questions here as of yet, so if there's any online. Can you hear me?
Yes.
Yeah, we can
perfect.
hear you. Thanks.
So yeah, no questions on our end.
A common question women ask me is, do I have to wear a post-mastectomy bra because I've had breast cancer? And the answer to that is you don't. You don't. And it's, Lisa, as Lisa says, a lot of post-mastectomy bras are very comfortable bras, and the bra manufacturers have focused on comfort, but that's not saying that you have to wear that bra. And some women do not want to go near a post-mastectomy bra shop after they've had breast cancer. That's not for everyone. So there's some people that really, some women that really want to wear those bras, and there's great women like Lisa who can help you, but you don't have to. But it's very unlikely that you'll fit into the bra you previously had before your breast cancer. And you can be guided in what type, there's lots of bras that, if you just get a bit of guidance on what to look for, you can buy them in Target, you can buy them in Best and Less, you can buy them in Rebel. Like, you don't have to wear a post-mastectomy bra, but you probably need guidance on what you should be looking for.
Deirdre, a question has just popped in here. It reads as follows. Some clients of mine have used 2 crop tops post-op for added support. Any opinions on that approach?
Yeah, so definitely the problem with a crop top after surgery is getting it on and off. Okay, so generally these immediate post-op bras, when you've got your drains in, we put you in a bra that does up at the front, that you can put in like a shirt and do up at the front where the drains are in place. So a crop top is challenging to get on and off when you have limited arm mobility and you have drains in place. After the drains are removed and you're moving your shoulders a bit better, then it's easier to get the crop top on. It's still a bit challenging though, depending how loose it is. So if it's so loose that it's easy to get on, often it cannot provide enough compression. So we guide women to look at bras more like what we call the hybrid design, that either has a zipper and does up at the front, or it does up at the back, but it looks like a crop top from the front. Okay? When women need to wear 2 bras, so just say you're down the track and you've got arm mobility going, then definitely wearing either what we call a encapsulation bra and with a crop top over it provides more support. And often women will feel they need more support and more protection. The problem we have is if they don't wear enough support and they don't feel protected, they do this. So women will instinctively brace and they protect and they guard their breasts. So that affects their shoulder, because I've got nothing wrong with my shoulders, and all I have to do is bring my shoulders forward and I can't lift my arm any higher than that. So a lot of women are thinking they have a shoulder problem, and really all they have is a posture problem, and they've just put their shoulder in a really bad position. So even then, if we go to the other extreme and we go for the women who don't have a reconstruction, that don't have that don't have any type of prosthesis, they want to go flat, I say to them, that's fine. You can go flat as long as your shoulders are here. If your decision to go flat and you do this posture to hide your chest wall, that's not going to work for your shoulders. You're going to get neck pain, you're going to get shoulder pain. So I go, the posture is so, so important.
Thanks, Deirdre. Something else I wanted to ask you is, it was evident from the qualitative results that you presented and some of the comments that your participants made was about the lack of information, but some of it was also about the timing of the information. Can you maybe explain a bit more what your thoughts are on the timing and maybe repeatability of the information?
It's not repeated, tragically. Some of them were funny, okay? Like, I'm a physio, and so I'm very supportive of my profession, but boy, the physios in the hospital got a bit of a bad rap. I've just had my breast taken off. I'm lying there completely traumatized. I've got drains in. Some snippet of a woman comes in for 5 minutes and tells me to run my fingers up the wall. So like some of them were really mad at how they were either they were bombarded with pamphlets. They're going, there's no way I could read. I just put it all in recycling. I didn't bother reading it. Or they were told when they're really drugged out, either straight post-op, they're given this list of instructions that they can't absorb, or they're so stressed, they're waiting to find out, am I going to live? And then you're giving them all this lifestyle information at that time. So really the timing of the information and the need for follow-up were two major issues that women had, that it's bombarded very quickly at a time when they can't absorb it and there's no follow-up with it. So that's why when we were with the women, because we ran focus groups as well with the women, when they were telling us all the problems they were having, and we said, how do you want us to teach you? How I want to help you. Tell me how. And they said, we want videos, we want them online, we want them only short duration, about 5 minutes, so I can have a cup of coffee and I'll put on a short video and I'll watch it. And they also liked podcasts. So they said, you know, I drive, maybe the longest I drive will be 15, 20 minutes. I'd like a podcast for that duration. So from this study as well, I ended up making a resource for Breast Cancer Network Australia, and that's called Physical Preparation and Recovery from Breast Reconstruction. And they've actually broken that up all into bits now. So it's on their My Journey tool. And that guides women in how to prepare for your surgery, how to prepare your home for post-op, and what are the post-op exercises you'll have to do for your shoulder, but also for your circulation. So women can take that piecemeal information. So, you know, definitely the way we do our translational research, we involve, not only do we involve patients in it, we actually say, you tell us what you want and we'll do it the way you want it. So it's delivered in that type of format.
Thanks, Deirdre. So there's one question, and maybe it'll be the last one, just to give people an opportunity to move on and have some conversations in the room. Are there compression singlet options used in sports that could be useful for breast cancer clients? So that's how it's worded here.
Absolutely. And, you know, definitely for women, so particularly post-op, like women who want to wear breast support at night, often the women who've had breast reconstruction and even breast conserving surgery, they feel more comfortable if they have some compression at night. So not only are they sports compression singlets that women wear, the transgender singlets are so cheap and they're really comfortable, and they have a do up at the side, so they can be doing up on your unaffected side. Then there's so many in your Uniqlo and in your Lululemon and in your Lorna Jane that make compression singlets for women. So there's so much you can put them in, and the singlet offers, like, we don't encourage women to wear bras 24 hours a day. We go, you really want to mix it up a bit, because you're loading your tissue all the time, and particularly if you've got lymphedema or a risk of lymphedema, you really want some freedom of lymphatic flow, because it's just underneath your skin that those tiny vessels are. So the singlet option is a really good option for women and really gives them comfort. So yeah, there's not only in the sporting stores, but also just in the straight lingerie sections throughout, there's lovely compression singlets that women can wear. Think of wide straps and think of good breast coverage when you're buying a compression singlet.
Thanks. Maybe just one more opportunity if there's anyone in the room in the library that has a question. Otherwise, we'll end it from our side.
No, I think we're right. Thank you.
All right. Well, thanks, Deirdre, and thanks, Jamie and others in the team, and thanks to everyone in the room for listening to us today. Thank you.
Thank you.